I have stage 4 breast cancer. Started 4.5 years ago. You just do what you gotta do. You know, you come in, you get your chemo, you have your surgeries, you do your radiation, and you just hope that it puts it off. You're never gonna be cured of stage 4 cancer. So basically, my outlook is kind of a chronic disease. And so we just keep trying to keep it at bay. Eventually it'll break through and it'll be done. My first doctor said, I can probably keep you alive 10 years if you do what I tell you to do. So, like I said, we've been working at it 4.5 years, so it seems to be working. What keeps you going? I'm just a normal person, you just keep going. I don't think about it that much, to tell you the truth. You know that, oh, I've got cancer, and I think that makes a difference. It's just like when I was working, you get up and you go to work every day. You know, it's the same thing. We don't have that many ups and downs. Every once in a while, we each kind of get scowly about things, you know, and I know he worries. He worries terribly, and that's very hard on me to watch him worry so much about me, you know, so that's one of the things that kind of triggers our up or down. But generally, we're pretty even about things, you know, we just know it has to be done, so we go do it. All of them are wonderful people. The doctors, I now see Dr. Curry since Dr. Ness left, and I like him very much. There's Glenna, who is just the sweetest person and the biggest hug in the world, and all the nurses down here are just, they're wonderful, you know, so you don't ever feel like you're alone. Dr. Curry's nurse, Sophia, is just the biggest sweetheart. There's always a hug. His office staff are wonderful people. They're all smiling. They know your name, you know, and that makes a really big difference. It's heartbreaking for them. And, you know, I watch them and I think, how do you do this? I'm grateful that they do, you know, very grateful. I would say, even though you're ill, there are many blessings that come with it. My daughters are now closer than they have ever been. I'm closer to my daughters than I've been for a long time. My husband's sisters, my sister-in-laws have gathered around me and have been very warm and kind. They always were, but you know, even though it's a nasty disease, it's a nasty thing that you're going through, there are a lot of blessings. So it's not all bad, not all bad at all. Well, it just depends on which kind of chemo drugs you're taking. If you're taking an infusion that's once every 3 weeks, you take the infusion and 2 days later you're down, and you're down for the full next week, and then you're up again. Yeah, I had 2 blood transfusions. You know, it was just nasty. It was hard on my system. The pills were not bad, except for the hand and foot syndrome, which causes your hands and feet to peel and hurt, and just, it's miserable. There are a couple of days there where I could barely walk. It's the side effects that get you. I mean, it's just, and some of them, like I said, are nasty, and you just get used to it. How very, very difficult it is. I know Frank worries constantly. Today, I closed my bedroom door, and he came tearing up the stairs. He says, "Did you fall?" You know, he's worried about me falling because I've fallen. He's worried about me doing what I'm supposed to do so I don't land in the hospital. You know, the day he had to call 911, I think just about tore him apart. He couldn't even wake me, and I'd been asleep for like 24 hours. And he couldn't wake me, so he finally called 911, and they took me to the hospital. They finally figured out maybe I had pneumonia. Anyway, that's what I got treated for. I don't know whether it's true or not. But the one doctor there, the hospitalist, talked to him for a bit, and he thought I had a heart issue. I didn't. My heart is very strong. And he told my husband, if there's anybody, relatives that want to see her, you better call them now. And that just about threw him for a loop. So we called my oldest daughter, and by the time my oldest daughter got here, I was sitting up in bed. That is an up and a down that you don't want to have to go through, and they do. They go through it time after time after time with you. It's very heartbreaking for them, and it's very hard work. It really is. I am so grateful for my husband. How much I appreciate them, how much I enjoy the interactions. It's not always about the chemo. Sometimes it's about family. It's about things they've done or I've done, or, you know, things like that. They mean a lot. That's part of the warmth of this group, is that they are like that. All of them. And it makes it easier, a lot easier. I would say I'm very, very sorry. Just take it step by step. Don't blame yourself, don't blame anybody else. It just happens. And it really, truly, this happens. Do what the doctor tells you to do and just keep trying. And don't dwell on it. You know, just don't dwell on it. And I know a lot of people, it's very hard for them not to dwell on it, and I do understand that. I'm not that kind of person, and so if you're not that kind of person, you won't have that problem. But I don't dwell on it. I have other things I'd rather think about and do. To me, it's really important to have something else to think about and do, and I would say that to you, you know. Don't dwell on this stuff. It's going to be what it's going to be, and you really can't change it. And I am very sorry for that. I think so. It's hard to watch other people go through it, and you will see up and down the hall here how people care about the other one. You know, and that's kind of neat. You know, you doing okay? You know, that's all they say to you. A lot of people, you know, it depends on your chemo day. You see them day after day, week after week, and so you kind of, hi, how are you doing today? You know, and I look at some of these people and I feel so sorry for them. They hurt so bad sometimes that you can't help it feeling their pain. You know, there's some good that comes out of it. It's not always bad. It is painful. It is nasty, but there's good stuff. It really is. I'm looking forward to my 50th wedding anniversary, so I can dance with my husband. Just to make it that far, you know, when we were first married, people didn't think that our marriage would last. And here it's lasted all of these years, and it's been a good marriage. It's been a solid marriage. Won't that be fun?
Good evening, Dr. Corey, medical oncologist with the Trails team. I'm here to talk about a very difficult and hard part of cancer journey, that is the treatments. I am a true believer that treating cancer is more than sophisticated technology and medicine. It requires compassion. That's the core of our values at Trails. We've seen videos of Kim and Anne. They share similar story, good people going and living their life where suddenly they were diagnosed with a dreadful disease called cancer. They share that diagnosis. They've been through the initial phase of not believing what's going on, and then understanding that they have to have the strength with them and their family to fight. And at this stage, they want to find a capable specialist who can provide not just the best care to treat cancer, but also they want a specialist who get them involved in their care. They want the specialist to give them options for treatment, educate them about them, explain their progress, how things are going with their treatments, treat them with respect and dignity. They want with their family to be involved in all aspects of their care. Through almost 20 years of practicing oncology, I've been through the early days where we really had few options, if any, to tell our patients what's available to treat them. It was very hard. Over the years, we started to understand cancer etiology more. We started to have more treatments. Then there was rapid explosion in knowledge. The puzzle started to get solved. And then we started to have more sophisticated therapies, like targeted therapy, which try to attack cancer cells and save the normal cells, into the recent immunotherapy, which I'm sure a lot of people here had heard of, in which we stimulate our immune system to fight the cancer. Almost every week, there is actually new kind of treatments. Now, we are starting to win the fight, and cancer is starting to lose after years and years of losing battles. When we want to treat cancer, we really need to treat patients. Every patient is different. There is no such thing as one size fits all. Every patient deserves an individualized and tailored care that is specific to their unique needs and to the type of cancer they have. We do provide that at Trails. We do follow national guidelines. If we know that there is a treatment which is helpful to our patients and it's not available at our facility or locally, we do provide the help and support and all means to our patients to go get that treatments wherever it's available in this country. We get up sometimes at the middle of the night, jump out of bed. My wife can witness that. Go to the laptop just because an idea comes to my mind about one of my patients that I feel it might be helpful, and I start looking it up. After a while, my wife actually stopped asking me where I'm going because she knew what I was doing. Now I take opportunity and try to sneak some chocolate when I'm working on my laptop. This explains the weight gain I had recently. So treating cancer really requires compassion. Compassion provides support to our patients. We support them all the way, whether it's a moment of success and victory or a moment of setback. We try to keep them and give them the support to keep their faith and courage to keep fighting. That's what we do, and we provide this at Trails. Thank you.
Hi, my name is Glenna. I'm an oncology nurse navigator at Trios. When I first meet my oncology patient, it's usually right after they've been told by the doctor they've been diagnosed with cancer. Cancer. Probably one of the most terrifying words someone could ever possibly hear. I can only imagine what they must be going through or experiencing at that moment. That is when I go in to meet with them. I turn the knob on the door, my stomach turns a little bit, I'm a little anxious before I go in there. sure what to expect, only hoping that I'll be able to give them the reassurance and comfort that they need. Sometimes I walk in and they're in tears, they're crying, and I just hold them. Sometimes we cry together, but I get a contact and a connection with them. And we can work together, and they know that they can always call me. I'm there to support them, to relieve any of their anxiety or stressors they may have. This is where their cancer journey begins. This cancer journey is not one that they will have to go through alone. This cancer journey is one that you will go through with me. I will take your hand and I will walk through it with you. I will educate you through your treatment, all the side effects that you will have. I'll be there to support you, get you through any of the side effects that weigh on you, pull you down. Most importantly, I will be there as your friend. I enjoy taking the time to get to know each of you as my cancer patients. You become my family, my friend, and someone very special to me in my heart. Being your navigator is a very big blessing to me. And the privilege of getting to know each and every one of you in a personal way. It means a lot to me. I don't leave you in the office when I leave my work. I carry you with me. I carry you home with me. I pray for you. I keep you in my prayers. I pray for your comfort, your recovery, and your peace. And I only hope that me being there for you can make a difference. When I get a phone call from you and you're terrified, or you're not feeling well, or I have to send you to the emergency room and you're scared, I will meet you in the emergency room. I will be there for you. I will take the time to hold your hand and to ease your anxiety and try and answer questions for you so that things won't be quite so rough. I will meet you in your hospital room. I will go to the hospital and spend time with you. When I first became a nurse 15 years ago, being an oncology nurse was the last thing that I wanted to do. I had several family members that had lost the battle to cancer, and it just wasn't something that I wanted to go into. Probably about 3 months after I was a nurse in my nursing career, I ended up taking care of a cancer patient on the medical floor. And I spent a lot of time talking to him, getting to know him. I learned of his life, his passions, his dreams, and he became very special to me. I got to know his family, and I made a very deep connection with him, and he inspired me. And after that relationship started, I could never see myself being anything but an oncology nurse. And I have been an oncology nurse ever since. I think the relationships that I have with my oncology patients are some of the best relationships I've ever had. They inspire me to be a better person. And their faith and their hope gives me hope. I remember a patient that I had. He was battling cancer for several years. And he'd been in the hospital for a couple weeks on continuous bladder irrigation. And he wasn't doing very well. And I would sit for hours and hours just talking to him about his life and his dreams, his hopes, and his love for his wife. He used to tell me stories of how him and his wife used to love to dance to country western music. That was their special thing. He had lost his wife several years ago, and when he talked to me about her and him dancing, we both ended up in tears. He was having to go to Seattle to get a special procedure done, and I really wasn't sure I was going to see him again. Sorry. I told him if he made it back and he wasn't on continuous bladder irrigation anymore, that I would dance with him. And he looked up at me and said, I agree. So we kind of had that plan. But I really wasn't sure he was going to make it back. So I gave him a big hug, and I kissed his forehead, and we said our goodbyes. A couple weeks later, he made it back to the hospital. He didn't have the bladder irrigation going, but he did have a Foley catheter in. When I went into his room, I looked at him, and I smiled. And he looked up at me, and he said, I'm back. Do I get that dance? So I looked at him and I said, I'll be right back. I ran to the nurse's station. I grabbed a portable radio and I brought it back to his room. I found a country western station on and I turned that music up. His daughter was there and she helped me stand him up. He was very weak. I hooked that catheter back in my pant leg. And I wrapped my arms around him. And we started to dance. And he smiled, and he laughed, and we just danced. He lost his battle to cancer a couple weeks after that. But he became a very special person and a part of my life. And I will never forget him. Each and every one of my cancer patients becomes very special to me. They are my family. And I am their advocate, and I support them, and I am there for them. And I do whatever it takes to make sure they're comfortable, and they feel secure, and they feel safe, and they feel loved. Because they have my heart. And they will always have my heart. All of you are very special to me, all of my cancer patients. They have touched my heart in a very special way. You are true warriors and champions and an inspiration to me every day.